LIP. My presentation is Glaucoma Awareness and Community Participation, though I do not have any financial interest. So, to start with few facts and figures, because glaucoma is one of the third leading cause of blindness in India, and around 12 million people are affected, account for 12.8% of the country's blindness. So glaucoma can affect any age group, including newborn, infants, children. These all we know, and what is most important is blindness from glaucoma is irreversible. So early detection is the key to preserve vision-related quality of life. So in population-based studies, there is a report of prevalence around 2 to 13%, and the global prevalence is around 3.54% in glaucoma. Now estimated burden of glaucoma in India is around approximately 11.2 million person aged above 40 years or older. They suffer from glaucoma. But most of those with the disease are undiagnosed or undetected, and there exists a major challenge in detecting and treating those with the disease. Now regarding the glaucoma awareness in India, there is a study from 2014 in a North Indian population, and they showed that there is only 8.3% of the respondents of the 5,000 individuals, they are aware about the glaucoma. Now, in a tertiary care hospital, in a study in 2013, it was similar that only 4.8% of the subjects are aware of the glaucoma. So, we concluded that the lack of awareness and knowledge about glaucoma is very poor, and we need to spread awareness about this glaucoma. But there is a big question that health awareness does not always match with the health seeking behavior of the population. Because I used to exercise, but I am very fine now. As per the picture, it doesn't match. So we thought, can our public health intervention can really improve the awareness and health seeking behavior for glaucoma? Now we all know that there is a national program going on about National Rural Health Mission and the Government of India, and there are community workers, we call them Asha Workers, and they are supposed to create awareness on health and its social determinants and mobilize the community towards local health planning. So we did a small study. We give a questionnaire to 30 Asha workers in a village health district in our West Bengal, and we give them very simple questions regarding the awareness of glaucoma, but we had a very devastating outcome. We saw that only 3 out of 30 Asha workers, they really know about what is glaucoma. So what we planned to train these Asha workers regarding importance of regular eye checkup, and so that they can bring more and more people to the health seeking to the hospitals. So we make them aware about the persons who are at risk for glaucoma, like the persons above 40 years of age, the family history of glaucoma positive, those with diabetes or thyroid or hypertension, or receiving some medications for long time like steroids, and who have some symptoms like seeing rainbow halos or very rapid change of glasses. So we make these risk factors imprinted in their heads so that they find out those people with risk factor. So we trained, we assessed, and again we retrained these Asha workers, and we had a target about bringing 10 persons by each Asha worker every week to the sector hospital. So we trained the Asha workers in our block hospital. Then we also trained the optometrists who are present in the block level hospitals to do the initial screening of the patients. Now after screening of these patients by the optometrist, one ophthalmologist will go to the sector hospital every month to do a detailed checkup and do the subsequent needfuls. So we found that we trained started training 30 workers, but ultimately 25 workers completed the module, and we subsequently, patients who were at risk found by the ophthalmologist or glaucoma suspects, they were brought to the medical college for various tests, and our finding at the last of 3 months. So at the 3 months, we had 25 trained Asha workers. They brought about to 2,800 persons, at-risk persons to the block. The persons examined by the optometrist, and among them only 164 were referred for the ophthalmologist. These 164 persons examined by the ophthalmologist in the block hospital were subsequently referred to medical college, and we came out with 46 glaucoma patients, and this is pretty rewarding for us, we think. We also got other diseases like cataract also. So our next target to create eye health advocates from these Asha workers so that this becomes a continuous process. But the key factors is more active participation from the district health authorities and training of Asha workers and all other staffs, but the need of funds is very challenging. So our ultimate goal is to beat invisible glaucoma and also to make people aware about glaucoma and change their health-seeking behavior. So we know little drops of water and little drops of sand, grains of sand, they can make our ocean, or even we as a small person can contribute as what this squirrel contributed to the making of the Ram Setu. That is really, we found nowadays that this is not a myth, this is a fact. So these small efforts will create a long-lasting positive outcome for glaucoma awareness in India.